Hey everyone, today we're going over one of the most important things for any commercial driver. What can disqualify you from passing a DOT physical? Whether you're applying for your first CDL or renewing your medical card, understanding these disqualifications can save you time, money, and your livelihood. It's important to note that having some of these conditions won't necessarily keep you from getting your med card. The doctor may just give you a 1-year or a 6-month physical to monitor your health more frequently. Let's start with vision. The Department of Transportation requires that drivers have at least 20/40 vision in each eye, with or without corrective lenses. You also need at least 70 degrees of peripheral vision in both eyes, and the ability to distinguish red, green, and amber traffic lights. The way that they test this is with a Snellen chart. You know, the paper with the big E. Your peripheral vision will be tested by moving a pin from the back of your head into your field of vision. The doctor will have you say now when it comes into focus. Monocular vision, meaning vision in only one eye, is disqualifying unless you receive a vision exemption or qualify under the updated FMCSA alternate vision standard. If you've had eye surgery, such as for cataracts or glaucoma, you'll need documentation showing that your vision is stable and meets the standard. Next, let's talk about hearing. You must be able to hear a forced whisper at 5 feet in at least one ear with or without a hearing aid. They test this by whispering a number from 5 feet, of which you're expected to repeat the number. If you're tested using an audiometer, your hearing loss must not exceed 40 decibels in the better ear at certain frequencies. If you wear hearing aids, bring them and the batteries to the exam. A diagnosis of epilepsy, defined as having 2 or more unprovoked seizures, is disqualifying under DOT regulations. However, the FMCSA may consider an exemption if you've been seizure-free for at least 8 years without medication or 10 years with medication. Other neurological conditions such as strokes, transient ischemic attacks, TIAs, brain tumors, or degenerative diseases like multiple sclerosis or Parkinson's may also disqualify you if they impair your coordination, reflexes, or mental alertness. Rightfully so, having a seizure while controlling 80,000 pounds down the highway is a recipe for disaster. If you've had a heart attack, angina, coronary artery disease requiring treatment, or a stroke, you'll need clearance from a cardiologist or neurologist, depending on the condition. You may also be asked to undergo a stress test or provide recent echocardiogram results. If you have a pacemaker, you can still qualify, but if you've had an implantable cardioverter defibrillator, ICD, you are automatically disqualified. The reason is simple. ICDs can deliver shocks that may disable you temporarily, which is unsafe while operating a commercial vehicle. Conditions like chronic obstructive pulmonary disease, COPD, asthma, or any lung disorder that restricts oxygen intake could disqualify you if they interfere with your ability to stay alert or perform physical tasks safely. Sleep apnea is one of the most common issues seen in drivers. If it's moderate to severe and untreated, you won't pass the exam. However, if you use a CPAP machine regularly and can provide compliance data showing nightly use, you may be cleared. Most examiners want at least 30 days of data showing usage of at least 4 hours per night. If you have insulin-treated diabetes, that alone doesn't disqualify you anymore. But you must bring a completed insulin-treated diabetes mellitus assessment form from your treating clinician. It must show that your diabetes is under control and doesn't interfere with safe driving. If your A1C level is too high, typically above 10%, or you've had episodes of low blood sugar causing loss of consciousness, that may disqualify you until it's controlled. Non-insulin dependent diabetics may still need additional documentation, especially if there are complications like neuropathy or retinopathy. Having type 2 diabetes alone is not an automatic disqualification, but how well it's managed makes all the difference. The DOT is concerned about how your diabetes could impact your alertness, physical ability, and risk of sudden incapacitation, like passing out from low blood sugar. Well-controlled type 2 with diet and exercise or medication will qualify you to pass the medical exam. They test for diabetes by doing a urine analysis to determine the sugar levels in your pee. If you have high sugar levels, they may require you to do a blood draw to test your A1C. Serious psychiatric conditions like schizophrenia, bipolar disorder, or major depressive disorder with suicidal tendencies may disqualify you, especially if not well managed. However, if you're under medical care and stable, you may still qualify with a psychiatrist's clearance. Drug and alcohol abuse is taken very seriously. A positive drug test for substances like marijuana, cocaine, opiates, amphetamines, or PCP without a legitimate prescription will result in automatic disqualification. The same goes for current alcohol dependence. If you're in recovery, you'll need documentation of treatment and sobriety before you can return to driving. Check out my video on DOT drug tests for more information about this. Certain prescription medications can also disqualify you, especially narcotics, benzodiazepines, or sleep aids, if they affect your alertness or reaction time. If you're taking a controlled substance, your prescribing doctor must certify that the medication doesn't impair your ability to drive safely. Also, any musculoskeletal disorders, including missing limbs, severe arthritis, or recent surgeries may require a skill performance evaluation to prove you can still safely operate a commercial vehicle. The DOT physical is about making sure you can safely handle a truck for long hours, under stress, and in unpredictable environments. Most disqualifications are not permanent, but they do require documentation, treatment, and sometimes FMCSA approval. If you're dealing with any of the conditions I mentioned, be proactive. Bring your specialist letters, test results, and medication lists with you. It can make the difference between passing or getting turned away. That's going to be it for this one. If this video helped you out, leave a like and consider subscribing. All right, bye.